Hello, everyone. Good evening. I'm Steve from UCAN English Tutoring. In this session, I have requested Nithya Soundarajan, one of my students who has achieved her desired scores for UK visa. She is a nurse and she has been working in Kuwait, for some time, and she has achieved 420 in her reading, which is the greatest score, because many people are struggling to achieve even 350. However, she scored 420 in reading, and then she got 360 in listening, 370 in speaking, and 300 in writing. She is the perfect example because she hasn't given up her she hasn't given up the OET examination. She has appeared, I think, a few times, but she always believing that she was able to make it happen, and she did it now. And I'm so happy to congratulate you, Nithya. And there is a quote which says that failure isn't when you fail to score, but it is when you stop attempting that. So it's going to be exactly the phrase that can be suitable for Nithya as well, because she was able to make it happen in her attempt just recently. First of all, I would like to congratulate you, Nithya, for achieving such a grand score in all 4 subtests, and I wish you all the very best for your visa processing. Could you please elaborate about your journey in OET and how I have helped you to ace the OET examination?
First of all, I'm really very glad to attend this session, sir. Really, what to say? I was so happy that, and thanks for your congratulations and all your support, sir.
Yeah.
Because I'm openly say this is my 4th attempt to attend the OET.
Mm.
I've been struggling for this the last 4 years. My
Mm.
journey started 2018,
Wow.
but yeah, it's such a long journey,
Mm.
and I don't know how everyone will continue the journey for this many years, for 4 years.
My God.
Really, we'll try one or twice, then we'll skip
Mm.
it. Oh, it may not work for me. I'll go to the IELTS or I'll go to PT or some other thing.
Mm.
But consistently since beginning, I never attended any IELTS or something else. Since
Mm.
beginning, I concentrated OET. I believe in that OET that I could achieve it. But
Mm.
since beginning, my problem is only the writing. Remaining all, I got B, 3B
Mm.
and 1C. That was my
Mm.
problem.
Mm.
Then after my 2 attempts, then I have seen your video in YouTube,
Mm.
and I had many questions before I'm writing before I was attempting the writing questions, like where I have to write a has been, where I will do had been, where it will come a simple past, and especially why we should write yours sincerely, yours faithfully.
Mm.
So many doubts, and I had that all the thing when I attended your your session in the YouTube. I have seen your so many sessions I attended.
Mm.
I was amazed with your answers.
Mm.
Why you write that really the thing I amazed is the sincerely and faithfully. When you
Mm.
somebody physically present, you will be very sincere to them. When
Mm.
you
Yep.
don't know someone else, you can be faithful only.
Mm.
That
Yep.
was a
That's.
really amazing answer.
Mm.
uh, that answer I have given during my clinical practice. Someone
Mm.
asked me while I writing my memo.
Mm.
That memo
Okay.
I put sincerely. They
Mm.
said, "Why you are writing sincerely? Why can't you write it faithfully?" I have
Mm.
replied the answer what you have gave to me. They all
Mm.
surprised.
Mm.
So
That's
so
amazing.
many things.
Mm.
Amazing, sir. Really, it's amazing.
Thank you.
Whatever. So what is my idea is, whenever you learn something, why you should not do, you should know the reason. Then only you
Mm.
won't commit in the future, and
Exactly.
you will relay that in various ways. Not
Mm.
only for the studying OET. It's
Mm.
been helpful to know common languages and some other thing
Mm.
also. So it's very
Mm.
important
Mm. Of
to know
course.
whatever with reason.
Definitely, yeah. I mean, you have not only just attempted to pass the OET examination, but you also, tried a lot to improve your general communication skills in English, isn't it? I can,
Yes, yes.
look at that, the way that you have been talking and the way you have improved your writing skills, when you started writing the OET letters, your skills have been improved a lot. And I was so amazed, to look at your success today, Nithya, and you definitely deserve this. Indeed, you deserve more promotions at your workplace in the future, and I wish you all the very best as well. And you are a perfect example for a hard work and dedicated student, and yeah. So can you please tell us what you did to achieve 420 in reading? It is It's a very good score. It's really amazing because you have scored 37 out of 42, while many students are still struggling to achieve 30 out of 42. How did you achieve this? Did you get any strategies from me? Were they helpful to you to improve your score in reading?
Yes, definitely, definitely.
Mm,
Before attending your classes, I was used my strategy, but
mm,
I don't know it is strategy. It's not really defined one.
mm,
Randomly, we will choose and we'll answer. But when after attending your class, especially in the part A, I will go
mm,
and choose only the keywords. The
mm,
scanning and skimming will helpful, but at the same time, you should not read the whole passage. You don't have a time at all. So you go to the directly. I'll start with the question number A, and
mm,
I will read from there. Then
mm,
first I will look at this four paragraph. What are the headings? The
mm.
definition, causes, and the
Yep.
treatment, and what are the future research? Like that,
Yep.
usually the topics will be.
That's right.
So I have idea that any topics will come. The four sessions will have randomly. These are the headings. Then
Mm,
I will go to the question. From the question I select the keywords. How many letters or how long have you been? That words I'll pick up. Then I
mm,
used to tell by my words. Yeah, normal level of hemoglobin in men. Normal level of hemoglobin in men. Like that, I will go and
mm,
search that word particularly
mm,
alone in
mm,
that part. So
mm,
that keywords, when you keep on telling yourself, your mind may not be distracted first thing. Then
mm,
you will look at only that one answer.
mm.
Then
That's
if
right.
I able to find out the answer immediately, I'll pick up and write. Otherwise,
Mm,
I'll skip it and I'll go to the next question.
mm. Yep.
And like
To,
that,
go on.
yes,
Yeah,
sir.
go on. Sorry.
This is the way I have continued.
Mm,
And regarding your dividing the part into X mark,
mm,
when
mm,
that usually when
mm.
I'll put it in a pencil the X mark,
Yep.
so it's easy for me to locate that answer.
Mm,
Even
that's
one
right.
paragraph, yeah, in
Mm.
one paragraph, if you put a X mark, it's easy to locate the answer.
That's right. That's right. Yeah. And to the people, who are watching this video, one of the major problems many students face is that they read only the question and they don't understand the question. So without understanding the question, they go to the text and then they forget some of the keywords. For example, let's say the keywords of a question are located maybe in text D, and then they read the text A from the beginning, and then they forget those keywords, and then they go to the question once again, and they read the question, and then they go back to text B, and then they again forget before completing text B, and then they go back to question once again, and then come back to text C and then text D. So they waste a lot of time. Okay, isn't it? That's one of the worst mistakes anyone can commit, especially in OET examination, where the time management is super critical. But one of the strategies which I have provided to my students is out now for everyone. Okay, so the strategy is going to be very powerful, and it is proven. You can immediately see the impact on your score. So the way to manage this is to read the question, understand the meaning, and then try to remember the keywords of the question while you go to the text. Please keep on telling these keywords of the question in your mind again and again and again until you locate the linking sentence there in the text. This is one of the super proven strategies that can help you definitely to locate the keywords of the question in the text quite faster. And please follow this strategy and you will be satisfied regarding the score that you get after using this. And this is what exactly Nithya applied, and I'm so happy that she deserve these scores, because she has been attempting for over 4 years. Remember that many students do not keep on attempting the examination for over 4 years or so, especially the people from Tamil Nadu, especially from the Tamil background. Many people struggle a lot and they give up after appearing for one attempt or two attempts. That's it. That's the maximum time they appear. But remember that it could be the third attempt, so it could be the fourth attempt, but you have to keep on improving yourself and you will definitely achieve your desired scores on one day. Trust me. And Nithya is the solid example for the same, and she has done a wonderful job by achieving 420 in reading, and I'm so proud of you, Nithya. You made me proud, and you made me happy. You made me feel like I'm doing something to the society, Nithya. And yeah, how did you manage your time in part A, B, and C in reading, Nithya? What did you do?
Yeah. So especially in the part A, the strategies what I followed is I'll tell the keyword. Second thing, when you locate the answer, you cannot write directly the answer because that may be a wrong also. But blindly you cannot write that answer. We have to check it with that question because sometimes the answer may be, for example, the last exam I written that first time when I didn't see that one. When I go through the answer again, I found out that the hemoglobin level was asked. The question is gram in deciliter, but the answer they have given in a first part of the paragraph was milligram in deciliter.
Mm.
I was first I blindly written that milligram in deciliter without seeing that on unit gram per deciliter. Then when I revised the thing, I found that it was the question is gram, but the answer I have written chosen from the paragraph one is a milligram. Then I rectified. They have given a gram in another paragraph.
Mm.
So that and all we have to be very careful with the unit. And also there is a paraphrasing, sir. Pregnancy and lactating, so breastfeeding mother, they given a normal hemoglobin level of a breastfeeding mother, but the answer is in the paragraph was lactating mother, so we should correlate breastfeeding mother is equal to a lactating mother.
That's right.
So
Yes,
that
that's right.
paraphrasing we should be very careful with the paraphrasing. And also
Yep.
that all questions especially I have noted that this 8 to 14 will be a little bit easy. From that 14 to 20 all questions will have some trick in that. If you find
Mm.
the trick, it's easy to allocate the answer. You should
Yep.
find out the trick where they
Of
given
course.
the trick. That one, that is very important. So whether
Mm.
it's a lactating, always I feel that the third fill in the gap was or
Mm.
paraphrasing. It's
Yep.
paraphrasing, and
Yep.
there will be some point to note to be noted.
Yep. Yep. All right. Yeah, that's amazing. Yeah. And how did you manage, your listening? What happened in your listening? Because you scored like 360, all right, which is really good once again, I would say. So how did you manage your time in listening and how did you get 350 plus?
Listening first to the 24 questions, usually we have a strategy that we should score at least 20 and above to
Mm.
improve our overall score.
Mm.
But yeah, I don't think so it should be important because I missed four blanks in my part A. I
Oh,
missed.
oh, okay.
Okay, but I
Mm-hmm.
believe that sometimes I cannot hear, or maybe the first session of the my exam, so I was so nervous and I was tensed. But then
Mm.
I had a hope that
Mm.
even you can achieve in B and C if you are
Mm.
right. So I
Mm.
was preparing my mind. Nithya, you missed the gap four, and
Mm.
out of 20, how many are right? You may not be know that, but
Mm.
still there is B and C. You have a hope.
Mm.
I just
Mm.
self motivated myself. Then I
Mm.
attended B and C.
Mm.
At B, I could understand all the things. B
Mm.
questions I can understand. C part, I never felt difficult with the C part because I
Mm.
focused on that words. Because usually the C part, they will start with one research topic on something.
Mm.
Then they
That's
will
right.
see the trial. Then
Yep.
they will see some persons are example. I have received a patient. And they will discuss about any one patient in
Mm.
that trial. That
Mm.
patient, what happened? The trial was success or failure,
Mm.
and then they will tell how they manage, and the last
Mm.
question will be always the future approach.
Yep.
This is
And and the way you thought is amazing because if someone misses one or two questions, okay, especially in part A of the listening, they may get fed up, isn't it? Because they
yeah
may feel it can also increase their nervousness during the examination. See, the examination is already going to put more pressure on you, and you are already under more depression, isn't it? And if you would lose some questions, other students might have been thinking in a negative manner. Oh my god, I have lost four questions. Okay, but one piece of advice I have got to everyone who are watching this video is that you have got 12 incorrect answers. Even if you commit 12 mistakes, you should be able to get still B grade in listening and reading. So please look on this side rather than looking on the side where you have lost one question only. It's okay, still you can commit another 11 incorrect answers and your score will be 350, isn't it? And your confidence levels are amazing, and this is one of the best things everyone needs to have. I heard so many people were losing their confidence after missing one question itself. And you should always be positive. Remember that you have to continuously be positive throughout your examination. If you are depressed, if you want to cry, go to the restroom and cry after completing your examination. So never ever sit, you never ever look back. So always you need to be ahead. You have to go, okay, what would be the next thing? Okay, what can I do? What can I do? So you gotta always think about the positive things in the future examination, rather than looking at back and then thinking about the questions you have left unattended. That's not good. And you made it anyway. I'm so happy, Nithya, that you have done a very good job. And as far as the speaking is concerned, you have scored 370, and it is so amazing, Nithya. So what did you do, and what was your previous score in speaking?
Previous score was 350, sir. 350.
Okay, so from 350 you have increased to 370, isn't it?
Yes,
So
sir. Yeah.
what did you do to improve another 20 marks in speaking?
The main thing before I'm not much concentrated on this introduction part. I randomly start as I like, but after your session, that the introduction part should be without mistakes. So I followed that. I'm a registered nurse. I'm a registered nurse, or somebody will tell I'm one of the registered nurses. So we have to use these two phrases. So I followed your thing. I'm a registered nurse working in this clinic, and how will I help you? Like that, I started my introduction part.
Yep.
And we mainly concentrate on the sub points. Based on the sub points, our questions will be
Yeah.
explain the procedure, reassure the patient. So
That's
I
right.
pick up the word from that sub points.
Yep.
Then I use it. That explain means they will reassure means something is bothering them. Reassuring means they have
That's
something
correct.
bothering. So you
That's
find out
correct.
that thing, because we can't like blindly we cannot follow all the things. So the patient should stop, should reply to us. So there will be one question to ask the patient to improvise, like what's bothering you, could you tell me, how can I help you? We have to know the reason why they are not cooperating. Then only you can encourage them uh, based on that specific need. So they will tell, yeah, because there was one session for me. The patient had a stroke. The spouse only, I'm talking to the spouse, and she said the partner had a stroke, and she was afraid that her own parents has died because of the stroke. So that was in her
Her
mind,
concern.
inhibiting her to approach for the further care. So that we have to find out. That I
Wow.
think that is the scoring part.
Wow, that's amazing. Yeah, so we need to act according to the kind of verb they are giving in each bullet point, and you have done justice to whatever has been asked for you to be followed in the bullet points, isn't it, Nithya?
Yes, sir. Yes, sir.
Okay, well
I
done, well
done.
done.
I just that all sub topics and sub points and all will club together. When they ask the reason and the last points, maybe when initially your speaking will be slow, then it will increase the speed. When you come at the last minute, you club that last sub points together, and you can finish it off. And in
Yeah,
between,
it's like a
always
summary.
reassure. Yeah,
It's like a
summary
summary,
and
right,
all.
at the end.
Yes,
Mm.
sir. And summary,
Yeah.
as you mentioned, that you need not to tell everything. Just pick up two
Just
points and just
important,
summarize.
yeah,
Yeah,
important points. Yeah, important ones. Yeah.
important 2 points. Like
That's
that. So
good.
I picked up the last two important
Mm,
points and I
mm.
just summarized.
That's amazing.
And
That's amazing. That's amazing, Nithya.
and the good
And
part that
mm,
my examiner was from Canadian. Oh, and at the end of the session, she said, "You have done a great job." She
wow,
appreciated on the spot itself.
that's
I have
amazing.
attended so many people, and
Yeah.
you apart from whether I'm not going to give you the score, but
Mm,
so far I attended from you. You are very kind, and always I feel that to
mm.
scoring the mark mainly will when show the empathy, and
That's
you
correct.
make them to will make
Exactly.
them to speak. Yeah, you
Exactly.
motivate the patient to speak. This two
That's
part, I
correct.
think, scoring part.
That's correct. Exactly. See, they are the clinical communication skills, and I have already listed out, I think, more than 50 phrases, for each actionable verb items, isn't it? Did you use them during your role
Yes, sir.
play?
Yes, sir. Yes,
Perfect.
sir. Yes,
Very
sir.
good.
Yeah,
Very
because
good.
always the two role play I have predicted based on my experience. One
Wow.
role play you have to appreciate the patient or the caretaker. The
Mm,
another role play you will show your empathy. I'm really
mm,
sorry to hear that.
mm,
I really sense your feeling like that. There will
mm,
be two. Of course, I have undergone this two scenario will come. But we usually will show the empathy, but at the same time we should appreciation also is one of
Exactly,
the.
you're right. You're perfect. Yeah, that is one of the best ways to establish a rapport with the patient, and you have done a wonderful job. And I'm so
Yeah.
happy that your score has improved from, let's say, from 350 to 370. It is a very good improvement. See, some students actually see the decrease in their score in speaking. Okay, sometimes they score 350, but in the next exam their score might have been decreased to 340 or 330 as well. Some people unfortunately face such kinds of experiences, but in your case it is the opposite. Okay, it has been always improving, and I'm so amazed, okay, to see that. And what about your writing? You have got 300 for the first time, isn't it? So what kind of advice do you have for improving your score, improving everyone's score?
First thing I was thinking my nervousness, when it is a 45 minutes you are under a stressful condition. uh, you maybe open your eyes but nothing going in your mind. You're just randomly reading the case note, but you're not putting yourself into that situation. And this time I received as a community nurse, not community nurse, it's a community respiratory consultant. So
Okay.
I was thinking myself as a hospital nurse. When the patient go to the community, what type of care the doctor can provide? Usually it will be
That's
a
right.
community nurse, but this
That's
time
right.
they given a consultant.
Wow.
So then we were thinking when what you will write the purpose. So we'll write
Mm.
the purpose ongoing care and management. But you are going to write for the consultant. Consultant, you cannot tell them to give a care. So I was writing a continue ongoing treatment and guidance I written.
Yeah, that's amazing. That's really good. Yeah.
So that phrases makes matter. That is important in the purpose, I feel.
That's right. That's right. Yeah. I think I gave you, like 5 key parameters that needs to be included in the introduction paragraph, isn't it? Were you able to follow them, Nithya?
Yes, sir. Yes, sir.
Okay, great, great. And did you do the planning as well, before you started writing the letter?
Yes, sir. That is important, sir. Actually. Because so
Okay.
first no need to be hurry up to start the writing. Maybe your friends all will start the exam the writing. The starting writing is not at all a matter. In between you will go and stuck up with that question what I will
Yeah.
write again. So first
Yeah.
I just had a play out. So my purpose will be this, and I just write the important points. So then we have to select the case notes, like already the patient treatment everything completed means don't focus on the finished one, focus on the future one, what has to be done in the community side. So we cannot go with this patient admitted with this time, this with symptoms, this investigation done, this was diagnosed. Already diagnosed, finish the process. So don't focus on that most. Patient admitted with definite symptoms, some investigation done, diagnosed, and the treatment was given. So it should be
Wow.
very simple with the first paragraph. Then you go to the social history. That social history, because community, so you need
Yes,
to be written clearly about the social. So that time
exactly.
you focus on the social.
That's right. Yes, you're right. Yeah,
Because community background is mostly based on your social support background.
that's correct.
So
Yeah.
what happened for me, the question they have shown the patient has a chronic smoker. So
Mm-hmm.
he have need to make them to involve in a smoking cessation program. So
Okay,
what
good.
I pick up that point, I written along with the social history. He's a
Okay.
chronic, he's a smoker for the last 10 years, and he used 20 cigarettes per day, which requires which kindly make him to participate in the smoking cessation program. So I included that final point recommendation paragraph here. So we club the points together. Otherwise there were so many points in the recommendation paragraph, you cannot write everything in the recommendation
That's
paragraph
good.
because
That's good.
it will be lengthy, it
Yes.
will be
So
lengthy.
yeah, I think it was exactly the same thing. Sometimes you may need to actually, like divide the points from the case. Sometimes, there may be some requests which cannot be placed in the requested services paragraph alone. You may need to shuffle them. You may need to put, drag them to put in the social background paragraph as well. So that's what you have done, also, which is really amazing. And yeah, so did you get some time to proofread your letter?
Yes, sir, because I completed early, sir. Because of all this strategy, I completed
That's
really
good.
10 minutes. I had it because that
Mm.
was a very great thing. You always recommend that proofread, no? I'm
That's
one
right.
of the laziest girl to do that one. But with this time, I have done what happened in my first introduction paragraph. The patient with infected exacerbation of COPD. That
Okay.
exacerbation, I really written as a spelling mistake, sir. When I revise only, I was found out that oh my spelling was wrong. So then I
Okay.
erased it. Then I written an exacerbation proper
Yeah,
spelling.
yeah. That's
So like that,
amazing. Yeah.
yeah, that's amazing. And also there was a one more trick I want to really tell that because I attended the Rebecca session prior to my exam. When you written some points, like some points you missed in the first paragraph, you written in the second paragraph. So if I want to, I feel that it has to be connected to the first paragraph. You have to erase. You cannot go right and erase everything, and you cannot write. So what happened? She instructed me that you can put the arrow mark
The arrow
which point
marks.
you
Yeah.
want to add to the day.
Exactly.
I added.
Exactly.
I added
Exactly. Yeah.
because
Yeah.
the
You can do
patient.
that.
So that was I have done that one. That was really I was previous exams I may not aware of this, so I was really confused, and I will add in some other paragraph and it will be messy. But
That's
this
right.
time I
Yeah.
put a arrow mark and I
Mm.
added in the second paragraph. I made it arrow mark to enter into the first paragraph. So I
Yep.
think. But really, in that case, OET really giving a privilege that they are really understanding our
Our
practical
concerns. Yeah.
difficulty.
Exactly. Yeah. Yes. And yeah, so you can draw, the arrow marks, in the worst case, if you have to eliminate the whole sentence, it is not good, isn't it? You have to erase and then put it back, so you can do that. But yeah, so when you do the planning, I think it's highly recommended to plan, appropriately, so that you can go and write the letter, quickly, and then you can finish it and you can proofread. Proofreading can save at least 10 to 20 marks, okay, from being decreased. Do you know what I mean? If you have misspelled, say in your case you have misspelled exacerbation, isn't it? And you
Yes.
are able to find out that mistake, in the proofreading time. So proofreading is critical for everyone, and you have done the same thing. And how did you find, my corrections, for your speaking as well as writing? How did you?
Really, it was amazing, sir. Especially writing. I'm not clear about the passive sentence at all. That
Mm,
passive structure was corrected by you alone. That credit goes to you only, sir. Because I'm not at all aware of that. How to exactly write the passive sentence, and as especially present continuous. There will be an
mm,
open action has been how to add, how to
mm,
write, and you are the one always recommending to write in a passive voice. And
mm,
also that's an active voice. Some sentence you should write in an active voice only,
that's
because
correct.
like
Yes.
pain and that
Mm,
and all, many of them don't know. He was
mm.
pain, and some situations will be always subjective, so the
Mm.
subjective should be always in active voice.
Yeah, for example, in the
Someone
social
cannot
background, we'll say Mr.
yeah.
James lives in a, in a 4 bedroom home or something like that. Yeah, she smokes, he smokes, he drinks, she drinks. In this case, it is important, to use the active voice. Yes, please, yeah, continue. Sorry.
Yeah, such because when someone tell that you have to write everything in a passive voice, we
Mm,
blindly write all thing in a passive voice. No, it
mm,
shouldn't be. Something
mm,
should be in active voice, means it must be in active voice. So
that's right.
some treatment recommendations, I suggest the my planning structure. You read
Mm,
everything. The first paragraph should come only 4 or 5 points. Based on that,
mm,
you constrain
that's right.
admission,
Mm,
patient admission date and date. No need to write the same year, means no need to write. Then the
mm,
condition, then
yep.
investigation,
Mm,
diagnose, treatment.
mm,
Just
mm,
short and sweet. Then
yeah,
come to the
that's right.
social. What
Mm.
happened? No need to write all the social history. If it is still
Only the
relevant to
relevant.
the yeah,
Exactly.
relevant.
Exactly.
If they lives or not living with the smoking
Mm,
and alcohol is important. If it is
mm,
normal, if it is not at
mm,
all more than the level, you need to write all these things also. If
that's
he
right. Yeah.
cigarette 1 or 2 per day, it's not important. If he
Mm,
consume weekly,
mm,
occasionally alcohol, it is not important. We have to think that in the recommendation paragraph, whether they
mm.
instructed that area any smoking
Exactly. You need to
cessation or any
correlate them.
alcoholic
Exactly. You're
alcoholic
right.
anonymous.
You're right.
If there is any recommendation only, you
Mm,
write that socialist. Otherwise, always
exactly.
based on the recommendation, you select the case note. If there is
Mm,
no recommendation, it's a
mm,
normal thing, no need to add at all. He lives
exactly.
with his wife or family, it is not recommended. He lives,
Mm,
whether he's a aged pensioner and something, for the depends the case. When you write to a
mm,
consultant, he's a aged
mm,
pensioner, it's not going to give any important. If with the
mm.
social worker, it matters.
Yes, you're right. You're right.
So
And we need to
always like that.
yeah, go on. Sorry.
Analyze the case note. And also in
Exactly.
the recommendation, you may see that there will be 7 or 8 points.
Mm,
Will be worried how I will write these 8 points.
mm,
With that,
mm,
always you should start with kindly make him to participate. It would be
mm,
appreciated. You can
mm,
combine only 2 points together. So when you
mm,
see 8 recommendations, you will be surprised how I will make it. It will be a lengthy
mm,
paragraph. So
that's
that
right.
all that during the time you pick
Mm,
out that one. which can be added in the initial paragraph itself.
Yeah, in
For
the
me, there
social
was
paragraphs,
only
yes,
uh,
exactly.
paragraph,
Or in the
and there is
medical
a
background,
medications
yeah, or in the
practical. Yeah,
current conditions paragraph, yeah, we can add, some
yeah,
of them, we can split them, it's like
split.
they need to be logically connected. Okay, that's very important
Yeah.
actually.
Yeah, logically. When you write the first paragraph, they written that prednisolone to be continued for 7 days after the
Mm,
discharge. You
mm,
write that you when you connect this, patient was commenced on the prednisolone, which has to be
mm,
continued for 1 week after the discharge. Finish the
mm,
point in the first paragraph itself. There's
mm,
nothing to be written. Everything should be in the recommendation. Our recommendation also should be
exactly.
3 or 4, 5 lines, and mainly the
Mm,
word counts. That
yeah,
too, I
that's
was morely concentrated, and I reduced my word count to only less than 200. I written only
mm,
180 words like this. I was
okay.
more concentrating on that. Word count is important.
Yes, of course. And I used to give you, 300 plus, I think once I gave you, I think 340 or 350. I couldn't remember, but most of the,
370.
yeah, 370. Yeah. In
370.
most of the cases, you used to get, 370, 340, 350, somewhere around that. But I think, if you might have missed maybe one or two important case notes. I don't know, because, everything else, if you didn't commit many mistakes, okay, and if you still get only 300, usually it could be the case that you might have missed one or two important case notes, because if you miss one or two important case notes, they can directly deduct at least 20-30 marks per case notes, depending on the severity of the case notes. Do you know what I mean? For example, you are writing a letter to a dietitian, okay, and then you are not including that the patient is allergic to peanuts and honey, for example. So this is going to be a risk factor, isn't it, for the patient? So if you don't include this, they will straight away cut at least 20 to 30 marks, at least straight away 30 marks are gone just for this one case note. Do you know what I mean? That could have happened, for your writing as well, because I was so confident that your score should be more than that. But anyway, it was your required score and you achieved it anyway. And I'm so happy, Nithya. I'm so, delighted. And thank you so much, for trusting my teaching skills and approaching me. And, you made me very proud, and you made my day anyway. And now I would like to give opportunity to everyone to ask you questions. Let's start with Celia. Celia, would you like to ask any questions to Nithya? Can you please unmute and speak? Celia, would you like to ask any questions? Okay. Jasmine, would you like to ask any questions? Jasmine, would you like to unmute and ask any questions?
Yes, sir. Thank you for this opportunity to talk with Nithya.
Yes.
Actually, we both studied together.
Mm.
She was. First of all, I want to tell Nithya I'm so happy for her this success, and I know how much she worked hard.
Mm.
She was my inspiration. From the beginning, when we are in the class, reading, listening, and all, she will be answering very good. And her problem was the writing, I know. Then I really admire and my inspiration by her. It was a great encouragement for me. People like me, saying like Nithya. Uh, so only the reading, I want to ask her reading only,
Please,
but
yeah.
she explained already. She told everything clearly how
Yep.
she
Yep.
scored. Thank you for this opportunity, sir. And I wish her very all the best for her bright future. All the
Thank
best,
you.
Nithya.
Yeah, thank you, sister. Thank you.
Yeah, and we will arrange, one more session in Tamil anyway. So it's going to be, yeah, it should be all right. Yeah. Mm. No worries. Yeah, let me check with the other students, one by one. And thank you so much, Jasmine. It is my privilege, to help everyone. Okay, and you could be the next Jasmine. Please, trust your skills. You can also make it happen. You can be in place of Nithya. Maybe in a month or two, Jasmine. Okay, and Jai Priya, would you like to ask any questions to Nithya? Jai Priya, would you like to unmute and ask? Yes.
Yes, sir.
Yes.
Hello. Nithya, first of all, I would
Yes.
like to congratulate. God
Thank you.
bless you.
Thank you, dear. Thank you.
I actually joined after 10 minutes as usual. I would like to ask you regarding part A time management.
In reading.
Yes.
Yeah.
Yes, Jaypriya, because the important thing we have to concentrate on the topic in between and the answers also. We have to be not randomly studying. We have to focus about what. This time my topic was anemia. And when I came out of
Okay.
the exam, everybody said it was very tough. But for me, I never felt it was a tough because all
Okay.
topics you're not going to dig into the topic and you're not no need to have a good previous knowledge about the topic. It's nothing like that. Just that time you
Okay.
concentrate on the topic and the what questions they will be focusing, that is important. And
Okay.
whenever you find the answers, you I my strategy, I started from the number 8, then I will do up to
Mm.
this 14, then I will go to the
Okay.
14 to 16. Then if I feel that I have some more questions, I'll go to the part A, because part A you have 7 questions, and part A
Yes.
7 questions.
Match
Yeah,
form.
match the paragraph. Five
For
will be
yes.
easy to find out. There is no need to crush your brain. But
Yes.
two questions will be mixing. The two question usually you may think the answer is in the part D, but they will give the answer in part B or A. Okay, so we have to
Yes.
be very critical when writing these two answers. Usually 6 and 7. The two will be always
Okay.
tough. That was my prediction. So when I go to 6 and 7 something, I'll be concentrating. They would have been given the same word in
More
pending, and also
conscious on those
more
questions.
conscious question, and also the exact word should be there. That is important. There will be like
Okay.
so many say all paragraph may convey the same message, but the exact word is important. The word should be
Yes.
there.
Yep.
Critical, some word is
Mm.
critical means critical, it should be there. We may write
Mm.
it is very
Mm.
emergency, no, but there will be exact word will be in the part A or part C, like that. That is important to. That was I by my practice I improved. Usually these part I used to make a mistakes. My
Mm.
score will go to
Okay.
18 or 17, but this time I was sure that I'll score 20 because I found
Mm.
all the trick in the questions. So when I
Mm.
look at the trick, I'm happy that oh, I found a trick, so this will be the correct answer. You will get your
You're
confidence.
right. That's right.
Yeah,
And how did you find my reading materials, particularly in a part A of the reading, Nithya?
it was tough, sir. It was really tough. Even the real exam, not this much tough, sir. I'm sure that your reading materials are very tough, sir. But the thing, when you read this material, you will finish your part A by 10 minutes. No need to
That's
be
what
15 minutes.
see. That's
That's
what
what.
everyone said. And how much time did you take, Nithya, in your actual part A reading exam?
Sir, I finished at 10 minutes. Then I was
10.
worried
Oh
whether
my
they
God.
commit any mistakes because 5 more minutes is there on the
Yeah.
board. I on screen 5 minutes
Mm.
more. So I was
Mm.
revising thing. I said no.
Mm.
When I revised only, I found that there was a unit mistake, milligram and
Mm.
gram. So then
Mm.
I rectified again and I have
Mm.
written. So
That's
always when
good.
you write the answer,
That's good.
one
Mm.
strategy you go,
Mm.
and if you have a
Mm.
time, come back and check. But
Mm.
usually it is not
Mm.
possible in all exams.
Mm.
So whenever you write in the first time itself, the answer should be right. So the
Mm.
time
Mm.
you spend for the question, it has to be right.
Of
Then
course, of course.
Mm.
always, and
Mm.
there will be some gender counterpart. The questions
Mm.
will have a something counterpart,
Mm.
the same part of that other people,
Mm.
and
Mm.
some words are there. It will be very, and also, and one more my suggestion is there will be a lengthy answer like
Mm.
transesophageal endoscopy. They would have
Mm.
been given in a bracket as an
Mm.
abbreviation. That
Mm.
abbreviation will enough for the answer. Don't write
Mm.
the whole sentence, because
Mm.
I followed that only the abbreviation. If I given
Mm.
atrial fibrillation or something, I'll just write the abbreviation which is given in the paragraph, because
Mm.
still you may get a full mark, because
Yeah,
don't
you
waste
may
the
get
time to write
marks. Yes.
such a
you
long
may you may
sentence.
get marks, but sometimes you may be at risk as well. It's better to, I mean, see, usually the answers, for part A, okay, especially with the short answer questions and fill in the blanks, may require up to 5 words. Okay, they can go up to 5 words. I mean, for one answer they can go up to 5 words. So it is okay to use both the abbreviations as well as the actual name, or just the abbreviation, or just the full name. That is fine. You can use both of them, but yeah, it's better to use both of them. All right, and you will not be penalized. Okay, do you know what I mean? If you write both of them, if it is there in the text, okay, as you see in the text, you copy and
Mm.
paste. That's what you're gonna do. All
Yeah,
right,
yes, sir. Yes.
and she has done
You
the
cannot
same thing.
create.
And
Yes, sir. If it is there, you can write it.
Of course, yeah. And one thing you can confirm, when you do the practice test is get good marks from my reading test materials. Okay, if you do it well, you will pass. Really in the real exam. Okay, 100%. I can give you 100% guarantee. Try to get 18 out of 20 in the most difficult materials that I prepare. Okay, all my materials are really hardest. Okay, are the hardest one. So you pass my materials, your success is guaranteed in the real exam. Okay, if you score less, because see, my intention is to prepare all my students for the worst situation. Okay, if the question paper is going to be really the hardest one in the real exam, what's going to happen? See, I don't want to give overconfidence to anyone. I would like to be genuine to everyone. I would like to genuinely improve everyone's skills, whether it is speaking, reading, writing, or listening. I wish all my students to be full-fledged, okay, enough to succeed in the OET examinations with more than what they are aiming at. That's why I prepare them for the the hardest situation. Okay.
Yes, sir. That's it. You're absolutely you're right, sir. Because see, this time the reading was very tough, really. But if I may not be prepared for that, all your materials are very tough. That's because I have practiced the tough one. So this exam, it's not that tough for me because I already practiced in such a way. Because the tough one will have some tricky instructions inside that. So that's why I was prepared my mind. When I look at the passage itself, I understood it is tricky. Then and I'm not afraid. And I was thinking, I know how to tackle this.
And one thing, there are so many materials which were prepared by other people who were not able to rephrase much, isn't it? If you practice maybe some other institutions materials, for example, I don't want to tell any names, but if you prepare the material, sometimes it will not prepare you very well enough for the exam. I mean, you may be able to underperform in the examinations because the difficulty level that they have set up in their examination is not really good enough. Do you know what I mean? In the real exam, because they may give you overconfidence, because you might have been scoring very well during the practice test. You might have been easily scoring 19 or 20, but in the real examinations, they are going to rephrase the words in the text. They're not going to give you, they're not going to spoon feed you. We need to remember this, please. Always remember this. So if you are able to get really good scores in my practice test, you will pass certainly in the reading subtest there in the real exam as well. Okay.
And one more advice I want to give in the B part of the reading, C part of the reading. Usually there will be two parts in the C part. But what will happen, because of the time constraint, you will go to the first part, you will finish up to 6 or 7 questions. Maybe you will have only running out of time 10 minutes, and you will go to that next part, the C part, part 2.
I mean,
you will rush up and next 2, and you will rush up and you will write maybe 1 or 2 questions you will read. Last 4, 6 usually inky pinky ponky, you will write something blindly and you will
that's
come.
correct.
But I know that was I also practiced, but what I have done this time differently, I have gone to that part 2 because usually that part will be easy.
The second
text 2 is usually easy, but we may not know that by practice only you can understand, especially in the last part. Text B, last 4 questions usually will be easy, but usually we may not spend the time for that. We will be sitting in the initial 4 questions or 5 questions by the time the time's up. So we will just write blindly. So you go to that last part, and also I will select the questions which, if it is have a lengthy answer, I'll skip that paragraph. Because the OET, a good thing, it will go based on the paragraph wise. So first itself, I will write down the paragraph 1, paragraph 2, 3, 4, 5, 6. So the 8th question will be from last paragraph only. So you go to that word, and I will read that where you have a very small answers, like usually the meaning answers, intuitive, like there will be some questions very small, meaning only, paraphrasing. That I will select and I will do. Then I'll come to the lengthy answer.
Exactly. Okay, I can rephrase this for Nithya. Okay, see, remember one thing, that in reading subtest, okay, especially in part C, let's say all these questions, okay, I mean all the 16 questions in part C of the reading can be classified into 3 different types: the easy questions, the harder questions, and the hardest questions. Okay, so the problem is, every student usually starts answering in the same order. Sometimes they pick up the hardest question in, let's say, in text number 1, okay, and then they spend really long time, and then they fed up, okay, because they are now running out of time. Even for the easy ones, they don't have enough time, and they just guess, isn't it? as Nithya said, they will, choose like, inky, pinky, ponky, so like they just guess and they choose it. But that's not good, as I mentioned, try to understand that based on the difficulty level, we have got 3 different kinds of questions and we have to identify the easy ones first. Try to complete them, out of these 16 questions, there may be about, let's say, maybe 5 to 6 questions that are quite easier. And try to complete them. They are the easy questions. Okay, and then go for the next 5 to 6 questions that are going to be a bit harder, as I said. And then the next 4 to 5 questions or so on are going to be the hardest one. So you can keep them in the last, in the end, and you can guess those hardest questions but not the easy ones. If you guess the easy ones, that's not going to help you much. Okay, because you're going to lose the easy and the what you can say, the easy ones, which is not good enough, isn't it? So that's what she has done. And thank you so much, Nithya, for sharing that strategy. And this is the one which I have taught to everyone. Okay, I have been teaching this everyone to the students, during the examination, during the sessions anyway. And yeah, Jayapriya, do you have any other questions?
No, sir. She is very clean and clear. Explanation is
definitely,
very amazing.
Yeah, definitely. Yep. Selva Kumari, do you have any questions to ask?
Thank you, dear.
Yeah,
Thank you.
Thank you, Jaypriya.
Yeah. Selva Kumari, do you have any questions? Okay, if you're at work, it's okay. And Sumati, do you want to ask any questions? Sumati, you need to unmute. Selva Kumari, Sumati. Yeah, if any one of you, can unmute and ask, that would be great.
Yeah.
Yes, Sumati, please ask any questions if you have.
Actually, I recently joined, and I actually I started I started to hear from speaking what she said, and Nithya, I want to congratulate to you, and it's clear that what she said, it's every strategist after I attended your class, I applied also the same thing she said. And regarding writing, I also reviewed that where I did mistakes, and it may be because of she stressed that she particular about the word counts. Maybe I felt like that now. So after I listened from her conversation, so it may be because of that I got 290 maybe. So I reviewed everything now, and it's very useful from Nithya, what she has given message about the writing. Thanks to you, Nithya. And regarding reading, actually, you said that it's not it's easy for you also, but I felt regarding part A, this time, because the previous time it's we got like I got like neonatal jaundice related to the phototherapy. So that was really easy, but this time it's a familiar topic, but the questions was really tricky, and I couldn't get answer in two. I usually what she said that is she started from 8, right? Me also, I used to do like from 8 to 24, and then I will go to 1 to 7, like. But this time I really didn't get for 2 answers in between. Usually I will get, and I will also finish within 10 minutes. So that's what we felt like this time. It's really tricky. But
she made
her
it
point
anyway.
all is really right. Yeah, she made it. Yeah. Her point all is right, and it's really useful strategy what she told us to also.
Perfect.
Yeah.
Perfect, Sumati. And Sumati, you will be the next winner. I'm pretty confident.
I
All
hope
right,
so.
I'm confident. Okay, I'm confident.
I'm really praying actually.
Yes, yeah,
No, after I listened from my conversation, Nithya, are you listening?
Yeah, sure, dear. Yeah, I'm
She's there.
listening.
Yeah. Because yesterday we were talking, and Jasmine Akka, I thought she was consoling me, and she told one incident that one girl, she was struggling with writing. Like, I think maybe you.
Yeah,
This is
maybe,
like I feel like.
Yes.
Yeah.
Yes.
So me also, I'm in the same situation that I'm getting. I feel like I'm also struggling in the writing. So. Now I got some ideas from your points that what are the things I need to focus if I could not get this time, even in the remarking, if I'm not getting, so next time if I'm writing, I will focus on the
Yeah,
thing.
but you will get it. I can give you 100% guarantee on that. On condition that you didn't miss any relevant case. That is the one and only concern I
Yeah.
have got for you. And I'm pretty confident, Sumati. You
When
will
Nithya was
pass.
telling,
Okay?
yes,
Mm,
sir. When Nithya
mm,
was telling, I just reviewed my letter really, and she
mm,
told that the examination she wrote it wrongly,
mm,
right? The same,
mm,
but I also did that. I
mm.
corrected myself,
Okay,
and
during
then when
the
I did the
during the proofreading time.
yes,
Wow, that's amazing. That's amazing.
proofreading time,
So
yeah.
proofreading is underrated by so many people, and unfortunately, most of them don't give time at all. Do you know what I mean? They keep on writing for 40 minutes, and it is one of the costliest mistakes they can commit, because it can deduct at least 20 to 30 marks. I mean, you could have really saved at least 20 to 30 marks by going through at least these mistakes, and you could have saved the time. But yeah, otherwise, it was really good. And thank you so much, for your strategies, Nithya. And now Selvakumari would like to ask you any question, some questions, I think. Yeah, Selvakumari, yes.
Sir,
You can
she
ask.
has written something in the chat.
Oh.
Please read for Nithya.
Okay, yes. Okay, all right. Yeah, she's at work. Okay. She has got inspired. Okay. And she couldn't believe that you are working harder for 4 years, and it is definitely encouraging her as well. It is definitely encouraging everyone, including all the Tamil students. Okay, because never ever give up. See, I'm here to help everyone as much as I can. I'm trying to help everyone. Okay, I'm trying to teach you guys the sessions in not only in English but also in Tamil, Malayalam, and Hindi as well, to make your goals achievable, and everyone can achieve. Please, try to follow the strategies, whatever I'm teaching. And yeah, so you just need to, reduce the mistakes that you're committing. Apart from that, you should be able to pass very well. And yeah, she is asking a question like, how did you manage your time, to find the answers in part B and C? I think you already shared the information, isn't it, Nithya?
Yes, sir.
Do you want to
Yes,
add?
sir.
Yeah. Do you want to add
Something
anything
more.
else?
Yes, yeah, something more is that B and C part. Uh, all there will be only 45 minutes. So always keep 35 minutes for that C part. So within 10 minutes, I kept for this one only B part, because the B part was really easy for me. So I was within 10 minutes, I finished that B part. So I
Wow.
know that C part would be usually tough one. So I have spent some more
More
time in
time.
the C part. More time.
That's
The
right.
idea is, the C part, you have to understand the concept, what they are talking about. So for me, this time I received that venom based medicine and the asthma in children. So the topics are really interesting, interesting
Good.
topic only. Really, I felt it is interesting, and the you have to understand the topic, what they are talking about. This time the venom based medicine, how they are using the venom for a medicinal purpose. That was the thing. So when I go to this each paragraph, you understand what is basically they're talking about. In this B and C part, there is no trick, and there is no key answers, no keywords at all. Basically, understanding. It's a whole understanding your concept, how you are understanding. That
I'm
is
sorry to
important.
interrupt in between. Yeah, I mean, there are strategies, right? I told you, like, there are 6 elimination strategies that you need to apply. Anyway, you need to understand the information. That is really important. Yeah, I understand that. We have to understand the questions, choices, as well as the text. Then we have to compare. Okay, then only we will be able to find out the information. But as you said, some of the questions, for example, the questions such as like in paragraph 1, what the author highlights. Okay, or they say from paragraph 2, the author demonstrates something. Okay, so if you get those kinds of questions, yeah, you may need to understand the main idea rather than finding out each supporting idea. You need to focus more on the main idea. So what you have said is right. But yeah, but we do have strategies, as I already mentioned, Nithya. So there are 6 elimination strategies. So we need to apply the elimination strategies and eliminate all of them. And these elimination strategies are available for the students who are enrolling in my courses anyway. And Nithya, I think you did you apply those things as well in your
Yes, sir.
reading?
Yes, sir. It's very, very important for the elimination strategy, because that only will work to get a higher score. Okay, and the important thing, the 4 answers too easy you can eliminate. The 2 will be is the one to find out the tough one. In that time, you have to think about the plural and singular. Then you have to think about the verb,
Yeah,
whether it
all
is a
those
was
things.
or
Yeah,
had been, has been.
exactly.
These
Yep,
2
yep.
things, and there will be some similar words.
Yeah.
Like a discrimination will be there. Here, there will be some differentiation. There will be paraphrasing.
Yes,
I
they will
strongly
be.
advise these 3 things. When you think, you will pick up that right answer.
Exactly. So see, I mean, as I previously mentioned, previously taught to everyone. So focus on those 6 elimination strategies, and if you apply them, I think they would be definitely able to help you out, to eliminate the options. And 2 answers are going to be very close to each other. 2 choices are going to be really close, but only one of them is going to be the correct answer. If you apply the elimination strategies, you should be able to eliminate one among them, and then the remaining one will be the correct answer anyway. All right, and yes, do you have any other questions, Lokumari? Is it all done? Anyway, I wish you all the very best, Nithya, for your time. And yeah, so you have you have spent some time with us, and you started sharing your information and knowledge, with everyone else as well, to help everyone to achieve their desired scores. And I thank you very much, Nithya, for your dedication and hard work, and you made me proud. And I keep on teaching only because of the motivation that I get from my students' success stories. And you truly deserve these scores. In fact, I was expecting you to score higher in writing as well, but I'm so happy that at least you were able to make it happen, for the UK scores, which are the dream scores for you. And I wish you all the very best for your visa processing, Nithya.
Yes, sir. Thank you, sir. Thank you.
Thank you so much. Thank you everyone else, for participating in the session as well. And I wish you good luck with everyone. Thank you.